Good morning, and thank you for joining us. This is Sunrise, and I am Alero Edu. Oh yes, I'm all on my lonesome today because my many boyfriends on this program have decided to be AWOL. Well, that's allowed from time to time, but I'm sure that in no time at all, one of them will be back to join me in presenting this program. As usual, an eventful week, but what really caught my eye was the launch of the electric car in Nigeria. The electric car. I found that very interesting indeed. In a country where you hardly have electricity, some areas don't have electricity for months, we are launching the electric car. We are launching the electric car. And guess what? It's going to cost, you know, when you write a check and you say, pay the sum of 50 million naira only. Well, this car is going to cost 24 million naira only. So my thoughts were, my imagination immediately flew to, okay, so I buy this electric car, because the governor said that they were going to have charging ports in filling stations and in other places as well. So I thought to myself, okay, so I drive my car, I'm running low on power, so I drive my car to a charging port and I plug it on. And of course, there's power failure in that port. So of course, I'm going to scream that name. You know those people. I'm not about to say their name this morning. I am not about to say their name. So that is what seems to be our problem now, getting an electric car in a country where there's no electricity. Well, we'll see how that one plays out. Now, I want to send a shout out to Mr. Oreduni of LASMA, who is making special effort in making sure that the officials that are on the road are well-mannered and well-trained. He did something on Thursday. You know, that traffic on Thursday on the island coming to the mainland, because I hear that the cause of the accident happened either around Ojuelegba or Adekunle or somewhere. Some trailer had spewed all it was carrying onto the road, and it caused horrendous traffic. And in that traffic, well, there were law enforcement, including LASMA, trying to ensure that the little movement you made was made in some kind of order. So a little incident, well, I'm not going to tell you about it today, caused me to end up at Surah in the LASMA office where I met this gentleman. And the way he handled the case was so impressive. And what he said to his staff, you know, about their training and all of that. Thank you very much. We do appreciate your efforts. Marshall at Surah, actually it's called Olowu, especially the marshal, that's the overall boss at Olowu. Thank you very much. We do appreciate the work that you're doing. And for those of you who live in Lagos, or those of us who live in Lagos, the third mainland bridge will be shut from midnight today. Shut completely, both sides shut from midnight today until tomorrow, Sunday, 6 p.m. Christmas is 4 weeks away. Normally, at this time of the year, we begin to feel Christmas. I don't know about you, but I am not feeling Christmas. Normally, by now, you'll see Christmas trees, you'll hear Christmas carols on radio. But I guess people are so stressed. And cost of living, inflation, you know, cost of fuel, everything is just going up and it's making people very, very unhappy. So they're not looking forward to Christmas because Christmas is a time where you spend. It's a time for giving. It's a time for loving. I mean, that's not to say that Christmas is the only time you give and the only time you love. You love all the time and you give all the time, but Christmas is a special season for stuff like that. And People's disposable income has been eroded into, so they may not have plenty of money to spend at Christmas. Not to mention the cost of food items. This is a time where people buy stuff, food stuff for their staff, rice, vegetable oil, and things like that. But I'm not sure many companies are going to be able to do that this year. Coronavirus took its toll. NSAS climbed on top of that and took its toll. Many businesses have gone under. Many people, the lucky ones that is, are on half pay. So what kind of Christmas are people going to have? That's a big question. I know that many people are going to have a very dreary Christmas. So in this period of Christmas, let us think about the other person. Let us think about that person who has lost his or her job. That little business person whose business actually was rolled into the ground during the coronavirus lockdowns, and then even during the NSAS, maybe his or her business was one of those that the hoodlums attacked. So let us think about them and reach out to them. No matter how little the help is that we give them, help is still help, and anything would be appreciated. That is what Christmas is all about. The season for giving, the season for showing love, the season that you spend with your family. Family, that's where it all begins. We're talking in our country about we have lost our values, we have lost our values. What are we talking about? The family seems to be breaking down. A child's first encounter with discipline comes from the home before he or she starts school, and then it's added onto it. So what is happening to parenting? What is happening to mom and dad? Are they there to guide the children aright? Why do we have so many hoodlums, as they say? Why do we have so many children who have no respect for elders, who don't seem to know right from wrong? This is a time for us to begin to think about all that and begin to set our path straight again. So much for my chat this morning. The menu. Today we'll be looking at the increase in COVID-19 caseload. Wow. You know, we were worried about a second wave. Well, maybe this is the beginning of the second wave. Well, we'll be talking about that in today's program. And then a big one, solving the Lagos Transport Challenge. Solving the Lagos Transport Challenge. That seems to have defied any kind of solution, but we'll look at that this morning. I'm sure that in light of what happened immediately after NSAS, Lagos State has put together some things to, at least in the short term, deal with what happened. Farm for All project. Well, they say we should all have little farms in the back of our houses, planting vegetables and little fruits and all that. We'll look at that and what is happening with that particular project, which is put together by some foundation. And then, as is usual, we shall close with the Artist of the Week segment. And all I can tell you is that he is a he, and a very interesting he. He was born in Nigeria, he grew up in the UK, and he ended up in Australia. Wow. Talk of an international man. But he is a Nigerian. So stay with us, and we'll talk about all this in the course of today's program. Thank you for staying with us. Now let's get the show started. On Thursday, the Nigeria Center for Disease Control, NCDC, recorded 2 coronavirus deaths. The first time in 6 days that the country recorded fatalities from the disease. While everywhere is almost open now, as in shops are open, schools are open, churches are open, activities are gaining momentum, What does this portend? Does this mean that a second wave of the virus is coming? Are we heading for another lockdown? But they tell us that a lockdown is not good for our economy, but we are not obeying the coronavirus COVID-19 protocols. This country has been hit hard, and the result is that our caseload is getting higher. The last time any death was recorded from the virus was Friday last week, when one patient died. The 2 additional deaths on Thursday brought Nigeria's total fatality toll to 1,165. Now, to look at this increase in caseload with us this morning, it's my pleasure to welcome Dr. Alero Roberts. Well, there are 2 Aleros out here this morning. Dr. Roberts is a consultant public health physician. Good morning, Alero.
Good morning, Auntie. How are you?
I'm
Nice
good,
to be here with
you.
I haven't seen you in ages.
I'm well. Thank you. Well, I'd also like to welcome Dr. Abby Abraham, who is a public health physician. Good morning, Dr. Abraham.
Good morning. It's very nice to be here this morning.
Thank you very much.
Thank you.
We shall also be joined by Dr. Oyeladun Okunromade, who is Head International Health Regulations, NCDC, and she will be joining us from our Abuja studios in just a moment. But in the meantime, we've got the 2 other doctors with us. Dr. Roberts, what would you say is responsible for this sudden spike?
To be honest, it's actually not sudden. It's something that we knew was coming. It's something that has been there. And unfortunately, what's happening is that as people are becoming more sick, they then present in the health facilities. Schools being back also has added to the numbers because we know that it has been spreading in schools. They get infected. The children do not get sick because they're younger, but they do take the infection back home to vulnerable parents and grandparents. And that's part of the reason why we're seeing what we're seeing.
Dr. Abraham, when schools reopened, there were fears that they shouldn't have been reopened when they did. And as soon as they reopened, we heard of some numbers. And I think I recall that one school recorded 200 pupils who had been infected. Do you think that something should have been done about schools reopening, maybe more virtual schooling for the children?
We are really in uncharted waters. And in the end, hindsight is always 2020. Lots of public health physicians and lots of researchers always work on paradigms and things like that. I don't think it is something that is very straightforward like that. Because if we had not reopened, if the schools had not reopened, it was a balance. There would have been other issues that would have come up with regards, their schooling, with regards the examinations, and with regards other things. There were also lots of cases of violence happening in the house. There were psychosocial, psychoeconomic factors and things like that. So I do not think it is a straightforward answer, really. I think in the end, we are going to always have to rely on facts and figures, but also we have to rely on the fact that we have to keep safe. We have to make sure that we follow all the infection control procedures. It is very difficult to tell whether if we had not why there were 200 cases at that point in time. It could just have been something small that happened. So what I would say is that instead of what we can do perhaps to avoid this is to continue to follow the infection control procedures and continue to take them even more seriously. I think we can get to a stage where we start to lower the cases of COVID just by following the prevention procedures.
Dr. Roberts, Dr. Abbey has spoken about us following the protocol, but I'm sure you have noticed that not many people even believe that this virus exists. And for that reason, people are not following those protocols. You see a lot of people on the streets without masks. And I suspect that it is now a crime not to wear your mask when you're outside your house? Please correct me if I'm wrong.
Well, apparently it had been gazetted that that you will be penalized if you didn't wear a mask outside. But I must confess, it's very difficult to be obedient to an administration that themselves are not being obedient. Because people look at what others are doing and they feel, why should they be obedient and sacrifice and suffer the inconveniences for themselves when those who are clearly supposed to be in charge are not doing likewise? I mean, we all know what has happened in Nigeria in the recent past, and it's still going on. We have been driven underground, and that's going to make it worse. So telling people to wear a mask outside, they're going about, they're trying to just get something to eat, something to keep body and soul together, make ends meet, trying to get children to school, trying to keep their jobs, trying to get a job, because many of people have lost jobs. And then you're starting to inconvenience them with this mask wearing, which in itself has a financial implication to a great many Nigerians. It's just not going to work. First of all, they need to see this discipline and determination from everybody in the administration, not just the NCDC, not just the healthcare workers. How do you wear a mask when you're busy trying to get into a bus? Maybe that's the only bus going to your area. Then they tell you that, 60% occupancy and it's full and you can't go. It's 6:45, it's 8 o'clock at night. You need to get home. So it's very, very difficult in a society that has, a society living under an administration that has not themselves been obedient, for us to now get the people to be obedient. I mean, I know one of the top guy in NCDC who confessed openly to us in public that they made a big mistake in that they should have gotten consensus from the grassroots and worked upwards with the community. You've got to work with community engagement. How do people believe that there's COVID or COVID is real? Like everybody still says, tell me the name of somebody that has died of COVID. And if COVID is the big bad thing that they are saying that has come from the US, then it's only the people that go to the US, UK, and Europe that are going to get it. They have no problem. They need to just make a living, get a job, make ends meet, feed the children, try and pay school fees, try and meet up with the rent.
Okay, Dr. Roberts, we'll come back after this break and continue the conversation, and you can take it from where you just left off. Welcome back, and thank you for staying with us. We've since been joined by Dr. Oyeladun Okunromade, who is Head International Health Relations, NCDC, and she's joining us from our studio in Abuja. Good morning. Dr. Okunromade, can you hear me? Well, we seem to have an issue with her, but I wanted to ask her a question that affected NCDC directly, but I'll take it to Dr. Abraham. At the crux of the matter of this coronavirus is each country's ability to test and have accurate figures regarding those infected and those dying. Many have said that our figures are not accurate because we haven't been able to test enough. For instance, of approximately 200 million of us, only about 750,000 have been tested. What are your thoughts about our testing capacity?
Well, the testing capacity could really be improved. I do know that NCDC have done a lot of things to make sure that they test as much as they can. But think about it. You have given a correct figure. What is the percentage of that, the numbers that are being tested? But I think we need to backtrack a little bit, even from the NCDC. And in a sense, key into what Dr. Alero said with regards, the grassroots and informing the grassroots and proper mass communication services that would even inform people as to what exactly is happening. I'll give you a quick example now. Somebody came from abroad and they went to one of the southeastern states and they were wearing their masks and they asked everybody at the airport, do you know about COVID? Do you know about COVID? Why are you not wearing the mask? And what did they say? They said, what is COVID? They didn't even know there was anything like COVID. And so, even if there was the facility to test, which I think the NCDC is really trying to increase. They keep increasing their capacity. They keep increasing their labs. What about the communication? What about the engagement with the grassroots? What about the focus groups? You know, just that service that actually goes to where the population is. That is, especially in the rural areas, and says, this is what is happening. You know what? Where are the shows, the road shows? I think we really have a big issue. We are not testing enough. And so I suggest that we really have to increase our capacity, not only for the labs, but for also actually educating people, you know, informing them, enlightening them, and then doing what you want them to do. It's no point saying people should wear masks or people should test if you yourself are not getting tested or if it is not being demonstrated. So we really need to do more, especially in the enlightening aspect. There was a time when NCDC, there was a law where they were asking people to come and test. There was capacity to test, but there were not people who were being tested. And so those are things we need to examine very, very closely and wonder exactly what is going on. My suggestion is that we do need to have proper mass communication, proper advertising services, people who have insight, who can go into the grassroots, who can really go and really spread this, because I do not suspect COVID is going anywhere very soon. Thank you.
Dr. Abraham, I'm surprised when you say that many don't even know that this virus exists. Because at the time of the lockdown, there was plenty of communication going out about it and why the country was the entire country was in complete lockdown. Some of them just knew that there was a disease, because I saw a video of a little girl who, when they asked her, so why are you not in school? What do they say is wrong that everybody is at home? And she says, they say there's one disease called coronavirus. Well, at least she had an idea that there was some disease that made her stay at home. So I'm surprised you say that. I mean, it's one thing to know about it. It's another thing not to believe that it exists.
And it is yet another thing not, as you say, it's yet another thing not to even know that it exists. And if you even look at the number of users we have, of people who use television, people who use videos, people who use phones, there's deep penetration, but it is not deep enough yet. There are, you know, pockets of people in the real rural areas who still do not know what is happening. And those are really the people I think we need to start targeting now if we want a robust group of people who we are going to test.
Let me welcome once again Dr. Oyeladun Okunromade, who is Head International Health Regulations, NCDC. Good morning, Doctor.
Morning. Thanks for having me on your program.
Good to have you with us. Now, we were talking about testing and how many, the numbers that we have tested in Nigeria compared to the population of the country. And we recall that your agency did say that we had enough testing capacity in collaboration with the state governments, you know, to take care of our requirements. Can you please tell us more about that?
Okay, so to shed more light into the testing, actually, in Nigeria at NCDC, we set a target of testing 1% of Nigerian population at the beginning of this response. And I would say that currently we are not near that target at all. We're just close to testing about 40% of the target at the national, looking at the national figure. Currently, in terms of testing, now we test about 30,000 tests per week. Gives us about 3,000 to 5,000 tests that is being conducted daily across the country. But that's to look at the national figure. But if we go to the state-specific figure, we'll see that some states actually, they have actually met the target and even surpassed the target. States like FCT, states like Lagos State, Rivers, they're doing the most in ensuring that the number of the population that are being tested are actually up to the target and even more than the target. But we are a federal system. We cannot base our our sources on the state-specific data. So at the national end, we say that we're not near the target. Most of the states are not really driving this process. They're not doing the most. At the national end, we keep encouraging the states because there is little to what we can drive at the national. We continue to work with the states to drive our policies. And we keep engaging the states to ensure that they keep reinforcing and ensure that people come out for sample collections and increase sample collections. We've worked with the states to ensure that we have sample collections located across all the LGA in the country. This is to ensure that we capture all the communities across the country. And also, we've also at NCDC worked with the states to build their capacity in terms of testing laboratory capacity across the state. Now, currently in Nigeria, we started with no capacity for COVID-19 lab to one. Now we're boast of over 100 laboratory, COVID-19 laboratory capacity across the country, with every state having at least one lab to test COVID-19. But as much as we can do, we need people to come out for tests. We need people to see the need to ensure that they come out for tests. And this is where the risk communication comes in. We engage with the state as well as all the media, partner with the media to ensure that we keep reinforcing the information and the need to increase our testing, to increase our tests across the country. And just like was mentioned, the most important thing to note is that despite the fact that the COVID has been with us for a while, there is this still mistrust or misbelief and misinformation within the communities. So we're working hard to engage more with the grassroots and ensure that we keep reinforcing the information over and over again. That's the only thing we can do. We won't get tired. We keep reinforcing the information and the need to increase our sample collections across different states.
Now, you talked about the grassroots. The local government is the government that is that reaches the grassroots. So what is the role of the local government in all of this?
For us at NCDC, we work directly with the state government, and at the state level, the state work directly with the local government level. So it's a form of a network. We network with the state, and the state network with the LGA. And the local government are the one in charge of the communities. They're the one in charge of the grassroots. We work indirectly with them. We build their capacities in terms of their risk communication. Aside the LGA, in each LGA, we have what we call the LGA Health Educators, and also we have the LGA NOA, the National Orientation Agencies, that we use to pass this information and disseminate this information across to the communities. And they are the one that actually involved in passing the information across, as well as disseminating the information to the people and making them see the need to come out for testing. And also we're using them as a form of a kind of a surveillance agent to ensure that they sensitize the community on signs and symptoms to look out for and the need to report if there is any. So the LGA are actively involved in this. We work directly with them through the state, as well as build their capacity at every level.
That you are getting, are they performing this role creditably? Are you happy with their performance in performing this role?
Yes, there is a forum where we interact, and also where they send the information on the activities that they are engaged in, and it's a kind of a feedback and a forward kind of a channel, and they are performing the role. We're happy with the role they're performing, and if we keep reviewing the process as well and keep giving them more information on how to go about the engagement, as well as building their capacity in terms of reviewing of strategies, or if there is any need to add more information. And we're working collaboratively with them, and we all have a forum where we interact, and they pass the message across to us.
Okay. Now, Dr. Roberts, looking at the figures from this week, are we heading for another lockdown?
What will not happen, because the impact on the economy we really can't face, and we will not gain anything from it. I think, I truly like what Dr. Kumar said from the NCDC, because I find that they've been completely realistic about the challenges that they're facing and the challenges we're all facing as a result of this. And I dare suggest that, in view of the fact that we will see more numbers, you will recall, sis, that I keep saying this thing, and it's actually true. We're all going to have to come in contact with this virus, one way or another. We are hoping the one way will be via the vaccine, which is a controlled, safe, effective way of coming in contact with the virus and building your antibodies and your immunity. However, there is still the risk and the danger of coming in contact with it the other way, getting sick, getting very sick, and then not being able to beat it. So we cannot convince people to come out for the test, because it's very simple. They do the test, they turn negative, they isolate for 14 days. What if you're a daily paid worker? You can't do that. And we're not in a position as a government, as a society, to support you to stay at home for 14 days if you should test positive. So there's very, very, very little incentive to come out and test positive, particularly also because a great majority of people are developing the infection and remaining asymptomatic, or at worst, mildly symptomatic. I think one of the things we really need to start paying attention to is updating and upgrading our health system to actually cope, because people will only come forward when they get sick. So what we want is a case where when people develop their so-called malaria, because this virus presents very similar to malaria with AIDS syndrome, when they get this so-called malaria, they have a trusted place they can go where they can be monitored. And if they do get severely ill and require respiratory support, which is the thing that's going to take you out, they will be able to get it. But, trying to get people to come out for a test, no matter how beautiful your testing centers are, no matter even if you can get the result fast, there's no incentive, because once a person turns positive, the only treatment you can offer is this isolation for 14 days, which, if they are asymptomatic, they are not going to actually, because they're too poor. We are actually too poor to be able to do that. So we are going to get an increase in numbers, there's no doubt, but we need to continue strengthening our health system. So far, we've been very, very blessed in being able to flatten the curve a great deal. But we need to not rest on our own. So I think government needs to listen to NCDC a little bit more closely.
Yeah, so how do we prevent, with the figures now rising, even though you spoke about flattening the curve, the figures last week don't speak of flattening the curve, because the figures spiked. And for the first time in a long time, we actually had 2 deaths in one day. So what do we need to do to ensure that we don't arrive at the point where there is another lockdown?
Well, the funniest thing is that
said it's not desirable,
Yes.
But we're going towards it.
Remember what I said about obedience and the administration not being obedient? You were not just now on channels transmitting the Kaduna Marathon. Did you see any of the public health interventions being taken seriously? Maybe only about 50-60% of the crowd were wearing masks. They were all packed closely together. You are running a marathon in a state. That means that it has some political commitment, some political will. And you can't even manage to do that and keep the public health interventions in place. Of course, nobody is going to believe anything we say after that. So these are the issues. We have to keep the public health intervention. Wear a mask when you're outdoors. If you can't stay away from crowded places, then please wear a mask. As much as possible, don't get into a crowded place. Wash your hands with soap and water for 20 seconds. 20 seconds, not just a quick, dash under the water. And if you can't wash your hands, please use a sanitizer. These are the things that are working. Everywhere where they have managed to quell this virus, look at Southeast Asia, Korea particularly, you will see that all they are doing is being obedient to the public health interventions. But that obedience must come from the top.
Dr. Abraham, at the heart of this as well seems to be the issue of awareness. The people are aware, but for some reason, they don't seem to believe that this thing exists. And this is the reason why they have refused to wear their masks. They have probably refused to carry their sanitizers. I mean, the mask one is pretty obvious, even though wearing of masks, at least in Lagos State, has been gazetted. So what can be done to skew the awareness being given, to convince the people that this thing does exist, and figures do show that some people have died from it?
Mm-hmm. Thanks for that. That's an excellent question. It's something that we have given great thought to. And one of the thoughts that I have personally is, Africa, Nigeria, we're still by and large quite a patriarchal type system. There's a father somewhere, there's somebody that we trust. The issue is trust. Now, I should also suggest that our places of worship, the mosques, the church, all the other centers of worship be brought into this equation right now. And actually, just like was said about the NCDC, how the national orientation agencies are actually working with the NCDC to spread awareness, we should bring these people on board now. These are the church leaders, the mosque leaders, and the charities. Now, I'll give an example. There are some charities, NGOs, who do palliatives. And I have witnessed where these NGOs will bring the people to collect the palliatives, and they will make them wait and watch a 5-minute video. And after, how to wash their hands and stuff like that. And after that, they will then give them a talk while they are giving them their palliative. It has a hugely psychological impact. That this is the person who is feeding me, and this person is telling me that this thing is right. We need to go into the psyche of the people now. It is very delicate. You will not listen to somebody you don't trust.
Exactly.
But if we engage these people, this huge group of people who are actually, instructing most of our population, I think that would also work. We have charities, NGOs, churches, mosques, all these people, and lots of other organizations who are working on the side. And I think they have to be brought as stakeholders on the table now and actually said, spoken to us and look, how can you help us to disseminate this? Now, these people are in the grassroots.
Dr. Abraham.
Also. You have the chiefs, you have the men of peace.
Dr. Abraham.
Yes.
I do apologize. We need to take a short break, and then we'll come back to you when we return from the break. Thank you for staying with us. Dr. Abraham, you were talking about creating more awareness so that the spread of this virus can be curbed.
Yes, I was talking about thank you for that. We call them mighty men now, but they used to be called hoodlums and thugs. They actually have a code of loyalty, a code of honor. They have their chiefs. Those are the people we need to start engaging now. They are the people we need to sit with and say, look, this is what is happening. How can we access your community? And they are the most. There's so many of them all over the country. So I believe that if we actually engage at this level and we come to these levels where we speak to them, we interact with them, and we gather them together, we don't need the masses. We only need their chiefs. So we get the chiefs together and we ask them, how can we communicate this better? They will tell us They would tell the government what to do because they know their people and their people trust them. I believe that we have to actually get to that level before we can begin to see any form of success. They would also tell you their problems because, like Dr. Roberts rightly said, COVID is not really their problem, let's be frank. They would tell you their problems. And I believe this can be a step towards even community transformation and even the national transformation we're looking for. We don't always have to throw money at everything. It's not always about money. Sometimes it's about care. Do you actually care for these people? Do you love them? Do you care for them? Even when they see that care, they would start to respond. So this is my thought, that we need to engage the community chiefs and the religious bodies and also the charities even more closely than we are right now. Thank you for that.
Dr. Kuromade, earlier, Dr. Roberts spoke about wearing of masks and how far it would go in helping us from getting infected and us from infecting others, but said that many were not wearing masks, maybe because of the financial implication. I mean, I don't know how expensive a mask could be that it would prevent a citizen from buying it to save his own life. But all these palliatives, you know, the word palliative has been flying around since coronavirus came. Could masks not be part of the palliatives being given to the people?
Okay, thank you for that question. It's important for us to know that as part of our campaign is to ensure that all Nigerians take responsibility for themselves to stay safe and also to keep safe. And by so doing, it's compulsory to wear face mask, especially in public places, and also to avoid mass gathering. But in terms of availability of face mask, that is why we have developed guideline on the use of cloth face mask, because not everybody will be able to afford the disposable face mask and be able to renew and change that. And so there is a guideline on the cloth face mask that can be sewn by a side tailor or just by using any fabric. And this is where the recommendations on how to go about designing this, it's available on all our media. And getting any fabric or getting any tailor to make that, it's quite cheap. And it's something that every average Nigerian would be able to do. But aside that, there are so many organizations, so many NGOs and partners as well that while giving out palliatives, they also distribute face masks to the masses. And also we have even a lot of religious houses that also give that to the community. They don't just give it to their members alone, they go as far as distributing this to the communities. And even we have some core members that are producing face masks and they're distributing it and making changes in the communities where they are serving. So there are a lot of opportunities like this for all Nigerians to have access to a facial mask, be it the clothing one or be it the disposable one, as far as they can afford it. So there's so many avenues to have that available. From our own hand, in terms of NCDC, we have a lot of healthcare workers that we provide this for as PPEs. And we support state, we support LGA, or on a monthly basis. And so it will be difficult for us to put that responsibility on ourselves and add it to ensure that we distribute this to the masses. But we have a lot of organizations, we have a lot of partners that have taken that up, and they're taking that as their own corporate social responsibilities, and they're making that available to the public.
Dr. Roberts, what are your thoughts about distribution of masks?
I think Dr. Kumade has said it very, very well. There is absolutely no reason why anybody should be out in public. Very worst. Wish I had my little cloth, bandana that you can wear across your nose and mouth. Being mask up Lagos is a thing and is now being written into the Gazette. We just need to bear it in mind. And the importance of wearing a mask is that it stops you actually touching your face all the time. You are now conscious. It makes you conscious of your nearness to others. It makes you conscious of the need to keep your hands clean and sanitized and not touch too many high touch areas. So it's more than just the wearing of a mask, in my opinion. It's also become a cultural mindset that makes you aware of where you are, what you're doing, and whether you really need to be in such a crowded place for such a long length of time.
But if there is now a law that says that we have to wear masks, surely it has to be enforced.
That issue of law enforcement, I mean, you all know what we went through, and hearing some of the numbers that were coming out, who's going to do the enforcement? Here's where we are relying on change in human behavior. And like NCDC is always saying, and I quote them, you don't have to be a statistic. You just don't have to be a statistic until there's a vaccine widely available and one is willing to take it. There are other very simple measures that you can do. One of them is just wear a mask. Just not that hard. It's not rocket science.
Okay, now there's talk about a vaccine coming out soon, Dr. Okunramade. How soon do we expect this vaccine to get to us?
Say it a little bit of ray of hope for globally as well as the Nigerian community. It's a kind of an exciting news to hear that the pandemic of over 11 months, we're having access to vaccine very soon. As part of the other part of the world, Nigeria has gone ahead as well to establish and inaugurate a national task force on COVID vaccine. This is being led by the National Primary Care and Development Agencies, NPACDA, their sister agency. They work with other multi-agencies to ensure that we prepare for this vaccine. We're putting up application for it, and we're working out logistics as well as the delivery pathway for the country. And for the coalition of on this vaccine, which is the pathway through which we are going to get access to the vaccine in the country, the coalition is called COVAX. It's put together by WHO, CEPI, Gavi, and a whole lot of international organizations. They've assured us that we're going to have access to vaccine that will be adequate enough for 20% of Nigerian populations. Of course, we're going to prioritize this based on the healthcare workers that have been on the front line of COVID response since the beginning of this outbreak. And also, we're going to look at the hotspot LGA and some silent LGA. Currently, we're conducting a risk assessment across some LGA in the country. And the data that we're going to generate from this, we're going to use it to prioritize for this vaccine administration. So hopefully in the country, in the first quarter of 2021, we've been promised that we should have about 12 to 15 million doses of COVID vaccine in the country. And that is some kind of a great news for us. Thank you.
That is not very exciting news, is it? For 200 million people, first quarter of 2021, 20% of Nigeria's population.
Okay, that's to say, that's for a start off. With time, as more vaccines are available globally, we should know that this is a global pandemic, and they're going to even prioritize countries based on their burden. And if we look at the data from Nigeria and even from Africa, actually, we're not near the global priority at all. So the news of getting, having access to 20% of this vaccine for our population it's actually some kind of a respite for us. But with that's for the initial start of. With time, as more vaccines are made available, we would have opportunity to request for more and also have access to more vaccine in the country. But for now, I think 20% is kind of a good news.
Okay. All right then. Now, in parentheses, what has happened regarding research going on within Nigeria concerning a vaccine? Dr. Okonomade, what is happening regarding a local vaccine?
Oh, okay. In terms of COVID vaccine, we don't have that capacity yet. Looking at these two vaccines that have been announced, the technology is a kind of a new technology in terms of the storage and the administration, and even to work out the logistics in terms of storing the cold chain and all the mechanisms. It's a lot of logistic kind of system that we need to put in place. So looking at doing a local research at the moment, maybe in the near future, as we have more data to back the process, as well as more evidences are available on COVID-19. But at the moment, the vaccines that are available is not something our logistics system in terms of the cold chain maintenance can actually maintain and take up as a local production at this moment. But as time goes on, we'll have more data to provide for that research purpose and see if there is an opportunity for us to take up the process. But for the local vaccines, we have other local vaccines that we're actually involved with. We're part of the Lassa fever research consortium group for vaccine, and is currently running. And we're also involved in other research with working with the agencies that are involved with this process. But for COVID vaccine, not at the moment.
Okay, Dr. Abraham. Festus Akimboyewa says Nigeria has been lucky so far in that COVID-19 cases have not soared as predicted. But another lockdown is inevitable to break the cycle of current increase in COVID-19 cases before it overwhelms our fragile health system. What are your thoughts about that? Because when this pandemic started, it was believed that it would just overwhelm Africa. But people are not dropping dead on the streets as was predicted.
Yes, I think there are many factors, some of which we are not even aware of. I mean, again, I must congratulate the NCDC for their quick at the beginning. The labs, the proactive way they started to work, setting up labs, task forces, and all that. And I believe that the index case was quickly isolated, and immediately lots of policies were disseminated. So that is one. The government was aware. The second thing I feel is that there are many theories as to why we have such a low case rate. Like we have all said today, it's not necessarily because we are strictly following any magical protocols or procedures, but there are many theories with regards to the sunshine, the vitamin D, some of the antibodies that we have. I think the latest theory is that we have lots of Africans, or should I say, in the sub-Saharan. This issue is actually this thing happening in the sub-Saharan region of Africa. So there is a theory about we have mild antibodies to some of the milder SARS viruses and things like that. So I'm not sure anybody really knows why our case fatality ratio is lower than in most other countries. But like I said, there's lots of thoughts around it, and there's a lot of research that is going on. Some people say because we have a younger population. I'm not so sure about that myself. I'm not sure about that. Because in those countries, like we know, lots of the younger ones were also seriously affected by the COVID. So it might have to do with the sunshine, the vitamin D, the antibodies we have, and things like that. So I think the jury is still out, but perhaps we could be enlightened further by the other doctors here. But I suspect the jury is still out as to why it is so low for us.
Whatever the reason is, Dr. Abraham, we say thank God for that. Dr. Roberts, do you have any theories?
Thank God. Absolutely.
No, none that have been proven scientifically. I think age is certainly a factor. Immunity, one's immune status is a factor. Vitamin D, sunshine is a factor, because these are all things that have been as prognostic factors of how a person may or may not react to the infection. But the jury is still out, as Dr. Abraham said. The science still has to be proven. All the hypotheses need to be proven to be theories before we come out on that. And it still does not negate the fact that this is COVID. Probably has a predilection for older age and people with underlying conditions. What about the next one? Believe you me, that is coming. This issue of human behavior change needs to be taken more seriously.
Yeah, Dr. Roberts, staying with you, when the pandemic started earlier this year, we spoke about our fragile health sector, and we were all locked in. I mean, nobody could go out, nobody could come in. So even those who could afford to travel out to have their little headaches treated in Germany or wherever couldn't go out. And we thought that that was a wake-up call for Nigeria to begin to sort out its health sector. Have you seen any signs of anything being done to improve that sector?
It's a difficult one to answer, because there has been a lot of commitment to health system strengthening, and not just on account of COVID. I mean, there has been a lot of commitment and words spoken towards health system strengthening, but some of the key issues are going to remain recruitment, remuneration, and retention of human resources for health. Sadly, a word to the authorities: merely buying equipment does not a health system make. You need the people. We need the scientists. We need all the cadres of health workers, biomedical engineers. We need them. If we don't have the human resources for health, both the curative, clinical, and ancillary, we can buy as many pieces of equipment that we want to buy, and white ribbon as many new facilities as we want to renovate. We need the human resources for health, and that's where the commitment has been, unfortunately, earworms.
Okay, we'll come back and continue this conversation after this break. Thank you for staying with us. Let me take this question to Dr. Okunramade. In the light of these rising figures, do you think that more stringent measures should be introduced? And if so, what should these measures be?
I would say that for COVID response so far, we have not done badly, and there is really no fear of second spike or second phase of any outbreak in sight currently. And in terms of reviving and also putting up a stringent other measures, I think for the measures that have been put in place so far, I don't think we have done badly in that regard as well. At the beginning of this outbreak, we acted promptly by ensuring that we close our borders. which was done timely, because if we are delayed, maybe we will have witnessed a surge in cases. And also, we also went ahead to close the intra-state movement. I think those measures are acted, they are conducted promptly enough, and they were adhered to some extent. And also, we looked at the available data with us at the national, and advise, we use that to advise PTF to ensure phase out of lockdown, as well as the phase out opening of the economy. So I don't think we need a any other stringent measures aside this, and I don't see us moving towards any phase of another lockdown, because looking at the statistics, the data coming in from different states, well, in the last 24 hours, we witnessed about 143 new cases of COVID. And looking at the figure for the past 2 months, because we usually use data to inform, to review our response and activities. For the past 2 months, we've been experiencing about 150 to 200 cases, with a little increase or decrease here and there. And some states, actually maybe like Lagos, that are having spikes, we keep following up and keep monitoring closely. So in terms of the measures taken so far, I think we've done fairly well. We've opened up aviation. We've opened up safe reopening of schools. We've opened up tourism. We've opened up other businesses. And recently, we just opened up NYC camp orientation. And while doing all this phase out opening up of economy, we have not experienced any major spike in the number of cases. So I think the measures taken so far have been appropriate enough.
Okay. Dr. Abraham, would you say that people are getting coronavirus weary? That's why they seem to be ignoring those protocols these days.
I think it has been with us for a little while. So there's a big possibility that is happening, especially as lots of other events have overtaken coronavirus at the time when we had a bit of a lull. But I don't, apart from the weariness, it's not, I think my thought is that we should start to also educate people and let them know that this is going to be with us for a little while longer. We're not just going to come out of it at Christmas and get a Christmas present of a corona-free, 2021, even though I really hope that will happen and pray. But I think we have to be very proactive, to strengthen our systems even more. There's one word I've heard us saying over and over again, and that is responsibility. I think we need to move now from the phase of we are telling you to do this to the phase of start to take responsibility for your actions. So, you can take a horse to the water, as they say, but you cannot force it to drink. And I think sometimes we want to force our horses to drink water. But we need to get to a stage where we need to explain to the person and the people that, look, this is for your own good. As you are protecting yourself, you're also protecting myself too. We're all protecting ourselves. So even with the mask issue, no matter how many masks you give a person, if they still feel that mask is going to give them asthma and kill them, they're not going to use it. Because a lot of people also have this thought about masks and the fact that the masks are bad for them. So it is more about people strengthening the system and taking collective responsibility for the matter at hand. Explaining that the mask is protective and not lethal. Explaining that washing your hand will help you not just with COVID, but will help you with several other diseases. So we have to, in a sense, integrate COVID into the other problems that we have in this nation. we still have lots of infectious conditions. We still have cholera and all the other gastroenteritis and other conditions like that, meningitis. We're getting to December now and stuff like that. So even another way we could look at it is explaining to people that the more you cleanse yourself, the more you wear your mask, the more you are preventing yourself, not just from COVID, but from other conditions. So we cannot get COVID weary because we're not meningitis weary, we're not gastroenteritis weary, we're not worried because they are still there. So I think we need to integrate COVID in a sense into what we are doing right now, into the whole public health sphere. That's my thought.
Okay, coming to you, Dr. Okuromade. We have, like Dr. Abi said, we have cholera, we have COVID-19, we have Lassa fever, and recently, yellow fever seems to have joined the fray. And we've had 1 or 2 deaths from yellow fever in the southeast and south-south. I mean, that was something we thought we had got over. And yet, we're here again. So what is NCDC saying and doing about this?
Okay, thank you for that question. At NCDC, year in, year out, we don't really have a break. It's been like from one outbreak to another outbreak, and it's our mandate. We have to ensure and protect the health of all Nigerians. So in the midst of COVID-19 response activities, we have to deal with surge of yellow fever recently, just now, and cholera is there. Lassa fever is coming up, also the CSM. At NCDC, once the surveillance system has picked this as an outbreak, we have gone ahead to also establish and inaugurate an EOC, Emergency Operations Center for Yellow Fever, which is currently operating in NCDC, and we shouldn't forget that we still have our EOC for COVID-19 that is going on at the same time. So we keep responding. We've established this EOC across different pillars, and we've also sent out the rapid response team to support the affected states in responding to this outbreak. And we have also issued out different public health advisories as well as the guidelines. And also we continue to engage the public on the risk communication, sensitization, information awareness, and also we keep engaging the media to ensure that the public health communication and we disseminate the appropriate information to the public on this on different preventive measures. But for yellow fever, one important thing is we're working closely also with sister agency, NPACDA, to conduct accelerated mass vaccination campaign in the affected communities, and that is what the next phase we're planning now, and it will be conducted soon. So we keep responding to any form of outbreaks, any challenges that it keeps cropping up, and year in, year out, that is our calling. That is how we are. We're always on the road to support the state, to support the affected LGA, and also to ensure that we build capacity at the state level to be able to respond to any smaller outbreaks within their home community.
Dr. Roberts, would you say that NCDC as well as the Ministry of Health are both doing enough to curb the spread of these infectious diseases?
To be frank and honest, being a teacher, I'll always say there's room for it. Equally give credit where credit is due. NCDC has done an amazing job rising up to the situation, given the constraints of resources. Government has tried to deploy as much as it can to the situation, but we are still playing catch up. This is a new virus and it picked us in a very vulnerable place. Our health system is not as strong as it should have or could have been, considering that we've been independent for 60 years. And we had a far more robust health system in the 80s and early 90s than we do today. And to try and turn that around, I mean, COVID has given an amazing opportunity for the resources that have been deployed to the health system, but it's still a catch-up game. I mean, I can only tell them, Dr. Kromade, you and your team, led by Dr. Chikwe, very dear friend of mine, are doing an amazing job given the challenges that I know you face, that you have faced from the past and probably still facing. There is still a lot of room for improvement, and this goes to the federal government. Like I said, no number of health facilities, no number of pieces of equipment are going to save Nigerian lives if you don't have Nigerian human resources for health in the right place, recruited and remunerated and retained.
Okay, so let's just spend the rest of our time together looking at how we can prevent ourselves from getting infected. What are the things that we need to be doing to ensure that we do not catch this coronavirus? Let me start with Dr. Abraham.
I think we're going to say that is going to still be our infection prevention protocols. Wear your mask. When I wear my mask and you wear your mask, we protect ourselves up to 90-something%. Wash your hands, 20 seconds to 40 seconds thoroughly. And then if you cannot wash your hands, wear a hand sanitizer. Just in case you do not have a mask, make sure that you stay at least 2 meters, that is your 2 wide feet, away from somebody else. If you don't have a mask, make sure you are usually outdoors because the concentration of the virus is much lower outdoors. And when you're going to school, you also make sure that you take your hand sanitizer with you, and you wear your mask. So it is still, we're still going to, the good thing about COVID is that we know how to prevent it. We may not know how to treat it. And we're still looking at the vaccine, but we know how to prevent it. I think that is a massive leap forward, something we actually take for granted. And if we actually follow those prevention procedures, we can be almost 100% safe. And so it is more about following those procedures and explaining to people why they have to follow the procedure. So it's not just saying wear your mask. It is telling them that if you wear your mask, you will save the next person from perhaps illness and death. Can you imagine somebody thinking to themselves, they were the cause of that person's illness and death? I think we need to start to open up to these hard conversations. The fact that that next person, you could kill the person just because you are asymptomatic yourself and you are, spewing the virus all over the person. So it will persist with the talk. We will persist with the advice and the education. And as long as we all do it, every single stakeholder takes their part, even in this fight, I believe that we will get some success. And those low numbers that we're talking about could get even lower. I believe we stand a big chance, even in this part of the world, to have a almost coronavirus-free environment. But that is, making sure that everybody is involved in the prevention of this.
Dr. Koromade, anything to add to that?
Okay, so she has actually rightly said it. What we have to do is to keep reinforcing and keep saying the same thing. That's the only thing we can do. Nigerians need to take responsibility. That is our campaign, and we keep saying it all the time. Take responsibility to stay safe. Take responsibility to keep safe. Ensure that you wear your mask, especially in public settings. Make sure there is a distance of 2 meters to the next person, and avoid mass gathering as much as possible. Ensure that you wash your hand with water, running water and soap, and also use hand sanitizer. These are basic infection prevention control measures, actually. They are not only COVID specific. It will also prevent other infections, will prevent you from getting other infections, as well as we need to keep reinforcing to the people that the risk is still there. COVID is still with us, and you need to ensure that you take responsibility to protect yourself, protect your family, protect the entire country. And lastly, I would also like to also urge that as we move into the festive period, if it's not exigent or if it's not really essential for us to travel, especially those that are in the Europe that are planning to come home or those that are planning to go over there, looking at the waves of events over there in terms of their second lockdown, in terms of their spikes and all that. I think we want to encourage all Nigerians to stay where you are. If it's not essential to travel, there is really no need to come home. This is the period where you can let go of our travel plans and ensure that we have a safe Christmas and have a safe holiday wherever we are. But if it's a must, you must come home. Remember that you have to do a COVID test where you are, and which has to be done 96 hours before departure. Upload it on the website and register to have a second test in Nigeria. And when you enter Nigeria, you'll be screened and you will not be allowed to go anywhere for the first 7 days after your arrival. So you look at it, does it really worth it? If you must really, if it's not compulsory for you to travel, our recommendation at NCDC at this period is please stay where you are and have a safe holiday. Thank you.
Alero, your last word on this, please.
Mine is going to go to the federal government. Let's make every effort to get the universities back on stream so that we can continue training the human resources for health that the government is going to need. And then everybody make a call on your political representative, your legislator, your House of Reps member, your senator. Ask why the health system in your immediate environment is not fully functional, staffed, and equipped. It is our right. It's our right to life. Let's enforce it. Thank you very much, Sister Alera. It's been lovely.
Thank you very much, Dr. Alera Roberts, consultant public health physician who joined us virtually, as well as Dr. Abby Abraham, a public health physician. She also joined us virtually. And Dr. Oyeladun Okunromade, Head International Health Regulations, NCDC, who joined us from our studio in Abuja. Thank you very much, all you three, for shedding more light on this for us this morning. Sunrise will return in just a moment with another interesting conversation. Do remain with us.